Hello, my name is Tracy Newsome, and I'm a physical therapist at Michigan Medicine who specializes in stroke rehabilitation and recovery. My colleagues and I have prepared a presentation for you regarding one-sided neglect. Neglect, sometimes called one-sided neglect, is a symptom which occurs after a certain type of stroke. It is when a person does not pay attention to one side of their body and/or room. This can be mild or very significant. If you see a stroke survivor leave food on half of their plate or not turn their head in your direction when you speak, it can indicate they are suffering from neglect. Neglect is more than not being able to use the recovering side. Think of it as a lack of awareness to that side. This common stroke effect can reduce the possibility of independent living and increase the potential for painful injury. The good news is that this condition can be improved. The brain can create new connections to improve the person's awareness of their body and surrounding environment. Our goal for this presentation is to educate you on the importance of acknowledging and using the patient's weak side in order to maximize recovery. In this video, we will discuss and share strategies for overcoming weak side neglect at the hospital, at the rehab facility, and at home after discharge. Here are a few things you can do at the hospital. Sit on the patient's weaker side, hold their hand, and encourage them to turn their head and make eye contact with you when talking. If they cannot look at you, try to be directly in front of them so they are looking straight ahead rather than to one side. The following video will demonstrate how you can encourage your stroke survivor to look towards the neglected side. I'm going to have you follow me with your eyes and your head. Here. Good. Now we're going to keep going. That's great. Good job. Here are a few more things that you can do at the hospital. Touch their weaker arm and leg and have them do so with their good arm. If they have difficulty turning their head in your direction, gently place your hand on their chin and slowly help them turn their head towards you, far enough for their eyes to meet yours. At first, you may need to do this several times a day until they can do it on their own. If they are able to use their weak side while lying in bed or sitting in a chair, even for a little bit, encourage them and help them to do so. Depending on the severity of the stroke, these techniques may not work for everyone. Ask your physical therapist for additional tips appropriate for your stroke survivor's specific situation. One note of caution, don't place the control for calling the nurse on the neglected side. It should always be on the strong side, where it can be found quickly. Some stroke survivors go to a rehab facility before they go home. At rehab, the patient will use assisted devices, braces, and other supportive equipment to promote use of the strong and weak side together and decrease fear and risk of falling. You and your loved one will also learn safe use of the weak side during mobility and therapy activities. Here are some tips about what you can do at home to include the weak side in daily activities. Ensure safety by performing transfers, as your therapist recommends. Provide recommended amount of supervision and assistance. Place the TV on the stroke survivor's weak side so they have to turn their head in that direction. Place the phone, TV remote, glass of water, or other necessities on the neglected side to encourage movement and awareness. After the patient returns home, they continue to receive care from physical and occupational therapists and other healthcare professionals. Outpatient therapies will continue to work on incorporating the patient's weak side into functional activities to maximize recovery. Your therapist will also give you more tips and simple strategies which will aid in recovering from neglect. In summary, one-sided neglect is a debilitating side effect of stroke, but it can be improved. Your goal is to help your stroke survivor use their neglected side as much as possible. You can help by ensuring safety during transfers, guiding their hand towards items they are not able to sense, placing the TV, phone, TV remote, glass of water, or other necessities on the neglected side, and including the neglected side during daily tasks. Thank you for watching this video. If you have any questions about one-sided neglect, please talk to your physical therapist, rehabilitation specialist, or your healthcare provider.